to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome back to a new episode of Ask the Patient Advocate podcast. Today's episode is a deeply personal one for me, and since February is Cholangiocarcinoma Awareness Month, I thought this would be a great time to share this with everyone. Cholangiocarcinoma, also known as bile duct cancer, is more than a diagnosis in my world. My brother, who was also my best friend, faced cholangiocarcinoma. I had the privilege of walking beside him for 7 years through private patient advocacy, through uncertainty, difficult decisions, and the constant search for answers. That experience changed me. It changed how I see healthcare, and it strengthened my commitment to helping other families navigate this diagnosis with clarity, support, and hope. Today, we're talking about what's new in cholangiocarcinoma care and what patients and families need to know. So joining me today is Christine, a member of our team. Welcome, Christine. How are you doing today?
I'm doing great, Dr. Borrelli. Thank you so much for having me again here at As the Patient Advocate podcast. Well, I know, Dr. Borrelli, that this is one of the hardest topics you'd like to talk about, right?
Mhm.
But for sure, not all of our listeners today know cholangiocarcinoma. So, can you share what exactly is cholangiocarcinoma is and why does it often feel so overwhelming for families?
So cholangiocarcinoma is a rare cancer that develops in the bile duct. So the small tubes that carry bile from the gallbladder and then to a common bile duct into the small intestine. One of the challenges is that early symptoms are often vague. And because of that, many patients are diagnosed at later stages, which makes treatment decision very complex. Historically, treatment options were very limited. And the life expectancy of a diagnosis of cholangiocarcinoma was very poor, often less than 15 months or even just a few months. But the good news is that research has advanced significantly in recent years, and that is beginning to change the outlook for many of these patients.
Right. And we're hearing more about precision medicine in cancer care. And how is that impacting cholangiocarcinoma treatment?
Precision medicine has truly transformed how we approach cholangiocarcinoma. So instead of treating every patient the same way, providers are now able to use comprehensive genetic and molecular testing to look for specific changes inside the tumor that's specific to these patients. So cholangiocarcinoma is biologically diverse. So that means that two patients, while they have the same diagnosis, they may have a very different tumor profile or makeup. In my opinion, early molecular testing is now considered essential by many specialists because it can identify genetic alterations that guide treatment decisions and open doors to targeted therapies. And this is a huge change in how we're able to treat these rare conditions like cholangiocarcinoma.
Oh, wow. I think that's huge, right?
Yeah, exactly.
Can you walk us through some of those genetic changes and what they mean, for treatment?
Yeah, so through molecular testing, doctors can identify alterations such as the FGFR2 fusions, IDH1 mutation, which is one that I'm very familiar with, the BRAF mutation, and the HER2 alterations. When these changes are present, targeted therapies may be available specifically to treat these tumors that are made up of these different mutations and so forth. These treatments are designed to block the specific pathways that cause these cancer cells to grow, and they are often more precise than traditional chemotherapy and may offer more improved disease control with different side effect profiles. So, immunotherapy is another area of progress. It works by helping the immune system recognize and attack these cancer cells. So, testing for biomarkers or tumor mutational burden helps determine whether immunotherapy could be beneficial. Not every patient will qualify for these treatments, but identifying eligibility early can significantly expand options. And one more thing that I wanted to point out is that even if you were unaware about this perhaps, and identification early on wasn't determined, you can still have testing later that may alter the route of your new treatment options and expand the availability. So, even though you didn't have this early on, you might be able to still get this testing.
I love that. That's very informative. So, this is a rare cancer, right? Does that make specialized care more important? And why are clinical trials and second opinions are so important?
Absolutely. So cholangiocarcinoma is rare, and not every center sees these high volumes of this cancer. And I can tell you firsthand, we saw that with my brother's situation. Locally, we were kind of hitting walls because we were just being told, oh, there's nothing we can do. There's no really treatment options we have available. And that wasn't the case. There was just no treatment options locally available. But, thankfully, we were able to overcome that barrier and you get that second opinion. So that's why second opinions and consultations at specialty liver or bile duct cancer centers can be incredibly important. These programs often include multidisciplinary teams like oncologists, surgeons, radiologists, and researchers who collaborate to create comprehensive treatment plans. Now, in addition to this, having a private patient advocate is going to help guide this research and determination of who the best second opinions and consultations could be, and then also too how to get those meetings and appointments and consultations set up in a timely manner. Because with cancer, time is very important. Clinical trials are also very critical. Research in this field is moving quickly, and trials may offer access to promising therapies before they become widely available. Sometimes that means exploring out of state care. It's about making sure patients understand all available options.
That's absolutely right. And the benefit of having a patient advocate during these times is, I think, very important for patients and their families. So with all of these, rapidly evolving treatments and complex decisions, this is where private patient advocacy becomes very crucial, right?
Yes.
How can a private patient advocate help in cholangiocarcinoma?
It really does. So, navigating a rare cancer diagnosis can feel so overwhelming. There are multiple specialists, genetic testing results, time sensitive decisions, and complex information. An experienced private patient advocate can help organize medical records, coordinate communication between multiple specialists, prepare focused questions for oncology appointments, guide patients through second opinions, assist in evaluating clinical trial options, ensure that molecular testing is pursued early on when possible. Experience matters because timing, organization, and clear communication can directly impact access to appropriate treatment. Most importantly, a private patient advocate helps ensure that the patient's voice remains the central focus in every decision.
That's totally right. Dr. Borrelli, from walking beside your brother for 7 years, what did you learn that you want, families to hear today?
Oh, there's so many things. So I learned that information reduces fear. I learned that being organized can save time. I learned that no one should feel alone in this journey. The emotional weight of cholangiocarcinoma or any related condition is heavy. Decisions feel urgent. There's a lot of ups and downs. It's like a roller coaster of emotional instability. The uncertainty can be very overwhelming, but when someone truly listens, helps you ask the right questions, and stands beside you, everything shifts. Support does not change the diagnosis, but it changes how you move through it.
I totally got you. Advances in cholangiocarcinoma treatment are creating new possibilities, but understanding those options requires guidance. So I'm sure your brother is very grateful to have you as his patient advocate to walk by his side while he's doing all the treatments and care. So
Thank you. So, if you or someone you love is facing cholangiocarcinoma, know this. You do not have to navigate this alone. And we at Pathway Patient Advocates help patients and families like you explore treatment options, coordinate care, and move forward with clarity and confidence. This work is deeply personal to me, and it is my mission to ensure that no family feels lost in this process.
I love that. For anyone looking for help for themselves or for their loved ones, there are so many ways to reach out to us. You can visit our website at pathwaypa.com, or you can give us a call at 947 517 8395.
Thank you, Christine. It's been a pleasure as always. I hope this conversation helps our listeners feel more confident as they navigate their healthcare journey. Have a great day. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.